Thank you very much, Frida. Frida and Amy, that was fantastic. So we'll move right along to Anne Deckert, who is joining us from the Public Health Agency of Canada, from the CIPARS, or Canadian Integrated Program for Antimicrobial Resistance Surveillance. Anne, if you're here and if you'd like to share your slides, that would be fantastic.
Hello, everyone. Can you hear me?
Yes, we can hear you. Thank you.
And can you see slides?
I can see slides. Now we'll get it into presenter mode and we're ready to go.
There we go. Okay. It's a pleasure to be here to provide an overview of Campylobacter surveillance in Canada, as well as some selected results. I'm a veterinary epidemiologist at the Public Health Agency of Canada, and I've been working in this area for 20 years. So there are 3 systems involved in surveillance of Campylobacter through the Public Health Agency of Canada. The Canadian Notifiable Disease System monitors trends in nationally notifiable human diseases. The Canadian Integrated Program for Antimicrobial Resistance Surveillance, or CIPARS, monitors trends in antimicrobial use and antimicrobial resistance in select bacteria from people, animal, and food sources across Canada. CIPARS is made up of representative, methodologically unified components at the human, retail, abattoir, and farm points along the food chain continuum. FoodNet Canada conducts comprehensive sentinel site surveillance of enteric pathogens from people, animal, food, and water sources, which is implemented through local public health units and provincial public health laboratories. I will focus primarily on FoodNet Canada and CIPARS, and we'll give you a little more detail on those programs. So within the human component, FoodNet Canada, as I mentioned, has a partnership with provincial and national laboratories to enhance subtyping of stool samples, which are positive for the enteric disease organisms of interest. An enhanced standardized questionnaire is obtained in order to gather further information about potential root sources of exposure. The retail component includes weekly sampling at grocery stores for various meat, produce, or seafood products, which are tested for target pathogens. And the water component involves sampling of raw surface water, irrigation canals, or recreational beaches. The farm component includes sampling of volunteer local farms for various commodity groups, including broiler chickens, turkeys, swine, dairy, and beef. CIPARS conducts active and passive surveillance for antimicrobial resistance and antimicrobial use in people and along the food chain. This schematic shows details of the different sources, settings, animal species, and bacterial species that we collect information on. In this presentation, the focus will be on Campylobacter isolates from active farm, abattoir, and retail surveillance, as well as human Campylobacter that is obtained from FoodNet Canada. The CIPARS and FoodNet Canada programs are integrated at the human, retail, and farm level for Campylobacter, with CIPARS providing national and regional data on prevalence and antimicrobial resistance, while FoodNet Canada provides detailed information at the community level. This combined data provides a more comprehensive understanding of enteric illness, AMR, and AMU at the farm level and throughout the food chain. Both of these surveillance systems are possible only through extensive voluntary collaboration with federal, provincial, and local partners, private industry, and academia. This collaborative approach has improved the sustainability of these programs and has resulted in extensive linkages that facilitate dissemination and discussion of surveillance findings with the decision makers in each sector. I'll present some selected findings from each of the surveillance systems to provide an overview of the Canadian situation. The Canadian Notifiable Disease Surveillance System has observed a substantial decrease in Campylobacter cases per 100,000 people over the last 20 years, from 38.49 in 1999 to 27.23 in 2019. Although, as you can see, this rate has been relatively stable since about 2009. On the agri-food side, looking at Campylobacter recovery from abattoir and retail samples, the highest recovery at abattoir is from beef cattle Zika, which is shown with the red bars, and swine Zika, which are the purple bars. And recovery from chicken Zika in blue is substantially lower. However, at retail, the situation is reversed, with the highest recovery from chicken samples as we would expect. The recovery of Campylobacter from retail pork and retail beef in Canada is under 3%, and therefore not included in routine surveillance. These relationships have been consistent since the inception of CIPARS surveillance in the early 2000s. Looking at the recovery of Campylobacter from chicken at abattoir in blue and retail in red over time, the higher recovery at the retail level is apparent. There also appears to be a general downward trend in Campylobacter recovery from retail chicken. Looking at this in more detail, however, there are regional differences, with the highest recovery in British Columbia on the left-hand side of the graph, and a decreasing prevalence as we move eastward across the country, which is left to right across the axis. The number of samples taken in Atlantic Canada on the far right were very low, which results in the large yearly differences that have been observed. As in the previous graph, the recovery at abattoir in blue is typically lower than the recovery at retail in red. And this species and regional level information allows for the discussion, development, and evaluation of appropriate and focused interventions. The next slides will describe some of the selected antimicrobial resistance findings. So this is a table with quite a bit of information on it, but it's a summary of CIPARS farm surveillance of antimicrobial resistant Campylobacter from broiler chickens, grower finisher pigs, and turkeys, although these results are very similar to the findings from CIPARS as well. Three commodities. Ciprofloxacin is highest in turkeys, which is the middle green bar there, and has remained relatively stable over the last 3 years. As you can see in the middle green bar there. And it's also relatively common in chickens and increased substantially between 2018. And resistance in pigs is the lowest amongst the three commodities, and has also remained stable over the last 3 years, between 8 and 12%. Looking at results overall, resistance to at least one class of antimicrobials is highest in pigs, and resistance to at least one class of antimicrobials decreased substantially in turkeys from 66% to 30% between 2018 and 2019. Hopefully you can still hear me, because it's telling me my connection's unstable for some reason. Looking at ciprofloxacin resistance in chicken in more detail, although this is a very busy slide, you can see that resistance in chicken from all food chain sources, which is retail in green, abattoir in purple, and farm in blue, as well as resistance in Campylobacter from human cases in orange, is generally highest in British Columbia, which again is on the left side of the graph. However, fluctuations within and between components make interpretation of this data extremely difficult. And although we have observed these fluctuations in antimicrobial resistance trends, it is noteworthy that in addition to the generally stable recovery at abattoir and retail, which was shown on a previous slide, the general recovery of Campylobacter on sentinel farms has been stable over time. It's also worth noting that since 2014, there's only been one reported use of FLUOROQUINOLONE in participating CIPARS broiler chicken flocks. That was in 2018 in one flock from British Columbia who reported use. In addition to routine surveillance, CIPARS and FoodNet Canada undertake research both to inform surveillance and to further investigate surveillance findings. An example of this is the IAM-AMR project. Although a lot of focus is on Campylobacter in poultry, and rightfully so, it is recognized that cattle and pigs are reservoirs of Campylobacter and may impact human health through raw milk, occupational exposure, and environmental contamination. Therefore, this project includes all 4 primary food commodities in Canada. The IAM-AMR models are designed to predict the frequency of exposure of Canadians to antimicrobial resistant bacteria from agri-food products, and the models follow agri-food production along the farm to fork pathway, where possible from finally human consumption. The models start with a baseline prevalence of resistance derived from the earliest sampling point we have available, ideally as close to birth or hatch as possible. And this prevalence of resistance is affected by practices or factors at each stage of production which affect resistance. These are grouped by stage of production, so farm, abattoir, and retail. And the approach is designed to address broad and complex questions by integrating different forms and scales of information to a single framework. The models are informed by studies from a single element of the models is currently underway. Oops. And just to finish up, as I mentioned, mentioned earlier, the CIPARS and Food Canada programs are highly collaborative programs. They would not have survived for the 20 years that they have, and that participation is greatly appreciated. And just to summarize what I've discussed in the talk, the Public Agency of Canada conducts surveillance of Campylobacter through 3 different programs for both enteric illness in general and antimicrobial resistance in particular for CIPARS. There were 27.23 reported Campylobacter cases. Am I gone again?
You're just about gone again. Sorry, Anne, and we're just ready to wrap up.
Okay, then I'll just go to this slide, and it has, if you're interested in more information on any of these programs, this is the contact information for that.
Thank you. Thank you very much. I'm sorry that it was so choppy. Hopefully you'll be around on Discord for anyone who also has questions there. And hopefully your internet will stay put for the panel discussion. So our next speaker.
Thanks.
Yes.